Sometimes older adults have to make choices about where they're going to live as they age. Stay tuned and listen to some real possibilities. Thank you for being with us today. For those of you who think that you don't have too many options as you age in terms of aging at home, home community-based services, and or going to a nursing home and or a long-term care facility, you don't want to touch that dial, because today we want to talk with you about other options that are available, that are effective, and that could really improve the quality of life as you age. So I am thrilled to have with us some practitioners as well as a national expert on the greenhouse. And that's not your backyard garden. That's something very different, but that could be a part of a greenhouse. And so I'm thrilled to have all of you with us today. Thank you so much for being here, Nicole and Susan and Robert. Let's get right into it, because we only have about 20 minutes to talk about this. So first of all, Robert, tell our audience, what is a greenhouse and a greenhouse option? What does that even mean?
Sure. A greenhouse is a new model of nursing home care that has been developed over the last 20 years and really turns nursing homes on their head. So it is designed to create small, warm environments where both the people who live in the greenhouses who need care and the staff have a very different experience. It was designed to create real relationships between the caregivers and the individuals living there, improve the quality of care, and also provide better jobs for the real heroes who deliver direct care every day. Susan, what would you add to that?
The only thing I would say is that we kind of think about it through our three core values, and it's kind of a frame. That physical environment you described as warm is real home. The philosophical culture, all about relationships, we call meaningful life, and really through relationships, enabling those living in the homes to be able to live meaningful and purposeful lives. And last but not least, and you called them the real heroes, we call them empowered staff. And it's really taking a look at our workforce and really making sure that they're well supported with the education, with skills, with everything that they need to be successful and to be in deep knowing relationships with the elders.
And that the relationship part is just so meaningful, because there is a relationship that is developed with the caregiver and the person needing care. And that relationship, I mean, they're everything from an advisor to a healer to a friend. And so those relationships are extremely, extremely important. Nicole, anything you want to add to that?
Yeah, just to kind of add on to that relationship between the caregiver and our elders. So at UMRC in Porter Hills, we actually own and operate a greenhouse home. It's 20 beds in Grand Rapids, Michigan. And we also own and operate traditional nursing homes. So I want to be really careful that nursing homes can be incredible places where joy and meaningful relationships occur. But what makes a greenhouse different is really how it's designed and those relationships. And we really wanted to take our care from person-centered, which is an incredible model, to person-directed. So our elders are in charge of directing their days, and our team members are there to support that. That's a very different model than you oftentimes see in traditional nursing homes, and it kind of flips that idea on its head.
How long have you been operating the greenhouse in Grand Rapids?
Yeah, since 2009. So in 2009, we recognized that nursing homes would need to move to more private rooms and private spaces. So a way for us to take our traditional nursing home and allow that to happen was to build 2 freestanding nursing homes, which the design of a nursing home or of a greenhouse home, if you've never seen, it's incredible. We have people drive by them every day and have no idea that it is a nursing home. It looks like 2 big houses on the side of the road. It's a pretty neat model.
Do you see that changing, like conversion of the traditional nursing home to more of the greenhouse?
Yeah, I can speak from an operator's standpoint, but I bet Susan and Robert have some to add on that. So we know as an industry that the shift as the baby boomers come into needing more aging services is potentially away from typical brick and mortar and more into small home models like the greenhouse homes, or even staying in the traditional homes. So we absolutely believe that the greenhouse model will be the future of what nursing home will be, along with a lot of home and community-based support. So Susan, Robert, what would you add to that?
I'll talk about occupancy. And I think, consumers are voting with their feet. And even during COVID times, the lowest the occupancy rates got were 90%. And you contrast it with traditional nursing homes that lower 70s, maybe upper 60%. So it's a good place to live. It's a good place to, when you think about the infection and the pandemic and such, it was a good way to stay healthy and to mitigate the spread of the infection.
Nicole, I would add, really thinking about this from a national perspective, what do we want for our long-term supports and services system? And we need options, and we need good options. So we need people to be able to access home care when that's the right option for them. We need various forms of residential care, whether that's good assisted living and affordable assisted living programs. But we will also always need a component of our system to provide very intensive services to people who are at a nursing home level of care. And what do we want for those people? Now, we know across the nation we have incredibly committed organizations and caregivers who want to deliver the nursing home care that we're all looking for. But we haven't always had the best model for nursing home care. We started with a hospital-based model. It grew out of sort of a hospital approach to care. And we've been transitioning over time to something that feels more like what we would want in our own homes and to receive in our own homes if we need to go to a nursing home. And I think that's really what Greenhouse delivers, whether it's in an urban area, in an apartment style greenhouse, or in a suburban or rural area, in the homes like yours that look like they would just be the house next door in the neighborhood. We're really beginning to see that successful transition and allowing nursing homes to be part of a modern, consumer-driven long-term care system.
That's an excellent point. And we want to stress that is that it's not a one-stop shop that everybody has to have one place to go. Everything is needed. And as Robert said, we need options. And that's one of the things AARP is advocating for people to have choices as they age and to age with dignity and respect and not to be just singled out and put into a place that they really don't desire to be. And I can say everyone, when we did our survey a year and a half ago, and I think it's like 89% of the people surveyed would prefer to age at home. They want to age in place. It's not always possible. We know that. And so we want them to have options, and those options should be options that provide the very things that you're talking about, the quality of care, the relationships, the dignity and the respect. And so we're excited, as an organization, we are very excited about those options and the work that you all have been doing and studied that very closely and advocating, quite frankly, for more options to exist for older adults as they age. So tell the audience a little bit about how do you find one? How do you get access to one? Does insurance cover it? Does Medicare cover it? What's involved in going to a greenhouse facility versus going to another type of facility?
So about 80% of greenhouse homes nationwide are licensed as skilled nursing. And that means that Medicaid, Medicare, or private pay would be the three predominant payers. We did a survey in 2017, and on average, we had about 42% of people living in a greenhouse home supported by Medicaid. Private pay rates are very localized. So, what does it cost to live in one? Well, it depends on the geography in which you're living. And private pay rates, vary from, I think the last time I looked, it was about $225 a day, upwards of $500 per day. So again, location. But yes, Medicare is, of course, short-term care. It's post-acute care. And so that means that you'll be in for rehab and then back to your own home. And Medicaid would be the payer for long-term.
Oh, I was just going to add, in some of the research that was done early on with the greenhouse, what we were able to show is that the cost of operating a greenhouse is no more than the cost of operating a traditional nursing home. So we're able to transition to this model with no greater costs than staffing costs and day-to-day operational costs. A challenge for any nursing home provider who needs to replace a program or wants to implement a more modern model are the capital costs. And those we don't do a good job of reimbursing for under either the Medicaid or the Medicare program reimbursements. So we need as a country to think about as our nursing homes literally wear out, 30 years old, 40-year-old buildings that are no longer the standard of care that we want. How do we fund that for the people who need that level of care? You know, when I think about the 30 years that I've been working in long-term care, we started with a real push toward home and community-based care because people didn't want to live in institutional settings long-term. We developed home and community-based care services to address that, but we now have a model of long-term residential care with the greenhouse, whether it's licensed as a nursing home or as high-level assisted living, that really, in my mind, is competitive with home-based models for the people who need that level of care and may not have the family supports, community supports, or even the physical environment to be successful at home. So we want to offer both of those. There are some cost advantages to facility-based care for people who have very high levels of need and need a nurse 24/7. So we need to think about both of those, but we do need to solve the capital cost problems, much the same way we did initially when nursing homes were developed across the country, where there was a very clear government program that provided very advantaged financing for communities to build the nursing homes that they didn't have at the time.
And you know, AARP, with some of the funding, that's what we're advocating for, is that there is more capital for nursing homes to use for the construction of more and more greenhouses. And so hopefully with this one-time funding, that might be a reality. Nicole, you were going to say?
Yeah, I just wanted to add, I think that there is a significant gap when we talk about the ability to access aging services. This is oftentimes something we're not thinking about until we are hitting a crisis. We're in the hospital, we're having the conversation that maybe your loved one can't go home, and we're making decisions from that point of crisis. And so I think that is a really big gap for our industry, is how do you pre-plan, how do you access information as you age? And I would recommend a place that you can go specifically for nursing home information is Medicare Compare. So Medicare will offer comparisons between nursing homes. I will tell you, greenhouse homes often score very, very high, but it's a very easy system to quickly be able to compare nursing homes based on things like quality and staffing and latest survey results. And so I think that's a really reliable source that people can go to when looking for a nursing home level of care and quickly be able to compare the greenhouse homes.
So what's the future look like? I mean, as you look at the next 10 years, what do you see in terms of a long-term care support services facilities? What do you see changing? What do you see happening?
I'd say incentives matter. And I think, it's really time we stop kicking the can down the road and we really invest in building infrastructure that are going to better support elders and the workers that support them. And as a former home care nurse, I'm a nurse, and I can tell you I did everything to keep people within their own homes. At some point, it's cost prohibitive and socially isolating. Yes, to more infrastructure to be built and developed to support those services at home, but yes, to incentivize a model that is working. And if, Robert was talking about the government incentives way back when with Hill-Burton Act and different things to try to develop something to support older adults. I think it's time that we, there was a bill, a $1.3 billion bill that was introduced by senators that wanted to see infrastructure for long-term care environments, traditional nursing homes, that would incentivize them to rebuild those nursing homes or to renovate them to small households of 5 to 14 people, private rooms and private baths. Sadly, I don't think that's going to make it in. I think the other thing, Robert talked about funding and financing, getting the capital. Why couldn't we provide incentives? Why couldn't HUD offer some incentives to those who were building this or other programs that would be able to incentivize the funding or the financing if you were building something innovative like this. I could go on with CON, Certificate of Need laws and such. I think it's time we remove the barriers to innovation and embrace something that we know worked marvelously during the pandemic.
Here, here, here. That just like I wrote it. That script is almost.
Paul, I want to add to also to what Susan said and reinforce the urgency. I am trying to help a family friend right now whose mom has mid-stage dementia, fell recently, is in rehab, and there are not options for her to come home or to go to a greenhouse in their community in Western Maine. So it's a real crisis, and the significant crisis is around workforce, particularly. We don't have long-term care jobs that people want to work in when they have the option of working in retail or fast food or a less stressful, less demanding job. So we don't pay well enough, we don't provide the proper training typically, and then we don't provide good jobs where people are valued and appreciated. The greenhouse does that. The greenhouse is designed to equally create a better place for people to live when they need care, but also for people to have a better job when they want to work in the direct care and long-term care sector. So it's important, it's urgent. We are running out of people who are willing to do the old style nursing home jobs. And several nursing homes in Maine, for instance, have closed recently for lack of workforce, not for lack of residents, but for lack of workforce. We're seeing this as a crisis with home care, as I mentioned, with my friends who are trying to arrange that for their mom. So, and this is true in every state across the United States. So we do, in addition to the rates and the capital, we need models of care like the greenhouse that create better direct care jobs that will attract and retain staff.
And caregivers is a huge issue. It's a huge, finding care workers is just a huge issue. Nicole?
Yeah, and I can just verify that from the operator side. A number one thing that we worry about is the workforce crisis. I can say in our greenhouse homes, we experience lower turnover, and we have empowered work teams. So there is validity to what Robert's sharing, and that traditionally caregivers like working in the greenhouse homes. And you had asked earlier about, the future. And I would agree from an operational standpoint, we want to create real home. For those that can't stay in their homes, we want to create that real home. And the greenhouse model is a really wonderful way of doing that. If you ever get the chance to see one, it's unlike anything you've ever seen. You walk into a front door, you first ring a doorbell. You don't just walk into someone's home like you would in a traditional nursing home. There is a table where all of our elders eat together. There's a central kitchen where meals are made together. It is real home. And if they can't stay at home, then our goal is to create that to the best of our ability.
Well, I'm going to commit to coming up once this COVID gets behind us after the first of the year and actually touring one of your facilities. I love to do that. I know we've got some B-roll that's going to be showing throughout the program. So where can people find, I mean, you said Medicare Compare, but will they have the greenhouses that are listed all over the state and where they can go if they are interested in taking a look or exploring that as an option for their loved one?
I suggest going to thegreenhouseproject.org. We have a map, and it shows you, it connects to each of our greenhouse communities, and you can go then directly to see if there is one in your community. We've got 362 homes in 32 states. So making some progress, not enough, but when you think there are over 15,000 nursing homes across the country. So they're a drop in the bucket in some respect, but there is a map on our website, and you can find out more information, more about research, more about advocacy, and what you can do to let your voice be heard to try to make a difference in creating the future that we all would want.
And Paul, I would add, so once you've checked Greenhouse, is it Susan, greenhouseproject.org?
Thegreenhouseproject.org, all lowercase. Mm-hmm.
Yep. So once you've checked that, if you find that there's not a greenhouse in your community, the other things to do are to check with your local area agency on aging and ask them what options exist in the community, particularly that follow what is more broadly called the culture change movement. So greenhouse is a part of the culture change movement. There are also models called household, and there are traditional facilities that have adopted the Eden alternative and other culture change practices, all of which are focused on what we've been talking about today, creating a real home, as Nicole mentioned, empowering staff, giving staff the value and the authority to make the day what both the people living in the nursing home want, as well as giving the staff the ability to have the relationships that they've come to long-term care to provide. So AAAs are a resource. Also, case managers or care managers that are specialized in long-term supports and services, so that you can find the right provider, the right setting, and reward the providers in your community who have taken on this significant challenge of reinventing and rethinking the way they deliver services.
Absolutely. Thank you so much. And Susan, you said it, we can all be advocates. Let's not wait for these professionals to make all the changes that we want to see for our loved ones. We have to lift our voice and let our elected officials and others know that we want more options for those as we age. Michigan is the fastest aging state in the nation. And so we're going to all be there one day. And I just appreciate the options that you've shared with us today and share with our listening audience. And I appreciate you, our listening audience, for watching Real Possibilities. Thank you.
Hello, my name is Craig Stiles. I'm a financial advisor with Ameriprise Financial. I get a lot of questions, and probably the most compelling question that I get presently is when an individual's been working for 25 or 30 years or even running their own business, they come to me and say, okay, Craig, can I retire? And my most subtle response is, I don't know. So we have to sit down and kind of evaluate, well, what does your retirement look like? What do you want your retirement to look like? And then we take a look at what they've done, how they've accumulated their portfolios, and then we start talking about what is their risk tolerance. In other words, what can they take what they've accumulated, how do they want that invested throughout their retirement? I typically anticipate clients to be retired for 25 to 30 years. So they're going to need their portfolios to last to 25 to 30 years. So that question on whether or not they're ready to retire is really a state of mind. Are they ready to retire? So that conversation actually goes beyond investments, and we have that question about what does their lifestyle want to be? Some want to travel, some want to spend more time with their friends and families. Some want to spend their money on their kids and just kind of build stronger relationships. And each situation, the advice I give is going to be a little bit different in regards to the products that we recommend and put into their overall portfolios to make sure that their cash flow needs are met today, that they're met to sustain their lifestyle and to do some legacy planning as well. Many clients also have some philanthropic interests that would take that into consideration. So all of that plays into a big role on whether or not they are ready to retire. So when I sit down and meet with them, or meet with you more specifically on understanding on whether or not you're ready to retire, or whether you're currently in retirement and are you meeting the retirement goals that you wanted to meet today. So I would encourage you to sit down and talk with your financial advisor. If you haven't got one, feel free to give me a call. I'd be happy to kind of understand your current situation and see if you are ready for retirement.
Hi, Amy. Welcome back to Real Possibilities. I have a question for you that we get asked a lot. How do people know whether or not their home is safe and prepared and ready for them, or if they should even return home after they've had some kind of traumatic experience in a long-term care facility or in the hospital or somewhere else? How do they know if their home is ready for them?
Well, you need to think about your home. You need to think about, do you have enough space for trip hazards? Do you have enough space for a wheelchair or a walker? Who's going to help you get in and out of bed if you need that, or in and out of the bathroom? That's a big one because a lot of people don't have enough space in their bathrooms for a wheelchair. So those are kind of things that you need to really kind of keep on top of. But there's also, when you think about that too, you need to go back and think about, well, maybe it is time to move into a more friendlier environment as far as safety wise. So most hospitals and skilled nursing facilities will not discharge someone if it's an unsafe discharge. So in other words, if this person is in a situation where they just really can't, they don't have a ramp, they don't have, they don't have the extra bathroom space, they don't have those things. So you want to make sure that those things, so think about that before you're going in. Also, just think about it in general. I mean, just in your day-to-day, because you never know what's going to happen. There's a reason they're called accidents. So you can't plan for it. It's just one of those things that you kind of got to do.
Yeah, it's helpful to plan ahead regardless whether you to have that space. So it's wise advice, very wise advice.
Exactly. Well, whether you're 20 or you're 120.
Absolutely. And
You got to do that.
I'll remember that when I'm 120. Thanks, Amy, for
right.
today.
Today's AARP trivia answer of the day is
Hello, my name is Dr. Amy Trent, and I have Dr. Joshua June here with me today from Great Lakes Center of Rheumatology. Dr. June, my patients are always wondering about misconceptions with wearing a mask and whether they can pass on COVID, and they just have a lot of questions about that. What are some of your recommendations? What are your thoughts?
Well, as I say to everyone, I don't want to wear this mask any more than anyone else, and these are imperfect things. They do not completely stop you from spreading COVID or getting COVID from someone else. But they do reduce the transmission of it by knocking down the trajectory of COVID being spread from someone who's infected. It does give you some minor benefit as well from contracting it yourself while wearing a mask. So it does help with that too. And a third thing is about the mask that a lot of people aren't aware of is that even if you do contract COVID while wearing a mask, it reduces the inoculation of the viral load that you would have received. For a very poor example, instead of getting 1 million virion particles, you're only getting 100, and that makes a difference in how sick you get or how deadly the disease can be. So the masks do play a role, and admittedly imperfect, but they are something that helps slow down the spread of now the Delta variant of COVID, which actually is a thing that a lot of my patients have misconceptions about. Unfortunately, and I felt as betrayed as everyone else, when the Delta variant became the predominant variant in the United States, we found out that even vaccinated people can spread the disease to others, oftentimes with no symptoms. The CDC has a number of articles on that, and I recommend that everyone go directly to the CDC website, not through an alternative source, directly through the website through the CDC, and looks that up. And you'll actually find where they show viral loads and spread can happen with Delta variant people who are sick with COVID. That's where the recommendation came from, is to continue wearing the masks even after you're vaccinated, even after you've had the booster. Obviously, we're going to see a vaccination down the line that'll take care of Delta variant as well. But that was a very good question. Thank you.
Thank you.
There's so many options that we have as we age. Hopefully today you receive some news that you can use.